Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs, brought to you by Lucid Quest. UNICEF has reported that childhood obesity has now overtaken underweight as the more common global condition. The report, spanning more than 190 countries, highlights that 188 million children, or 1 in 10 worldwide, are obese. Since the year 2000, obesity rates have tripled, while underweight rates have declined. This shift may significantly influence future public health policies and payer considerations once more data is available. A new Lancet analysis shows that deaths from chronic diseases like cancer, heart disease, and diabetes are declining in most countries. However, the pace of progress has slowed since 2010. The United States ranks among the weakest performers. This slowdown poses a threat to the United Nations goal of reducing premature deaths by 1/3 by 2030. A University of Toronto study has found that high levels of THC in follicular fluid are linked to abnormal egg chromosomes and reduced embryo quality in women undergoing IVF. The research analysed over 1,000 egg samples. While limitations exist, such as small sample size and maternal age as a potential confounder, these findings may affect fertility treatment guidance. The PRIME trial has shown that biparametric MRI, which does not require contrast agents, detects clinically significant prostate cancer, just as well as multiparametric MRI. The study of 555 men found no differences in detection rates or the need for biopsies. Importantly, biparametric MRI is faster and less costly, suggesting it could broaden access to prostate cancer screening. In the United Kingdom, the National Health Service has launched a trial of a blood test for Alzheimer's disease. The p-tau 217 test, priced around £100, is being evaluated across 20 clinics. Early findings suggest accuracy above 90% compared with standard cognitive testing. If validated, the test could enable earlier diagnosis and intervention at scale. A Nature study has revealed that lung tumours can reprogram progenitor immune cells into immunosuppressive states through the NRF2 pathway. Blocking NRF2 with agents such as brusitol and ML385 improved immunotherapy effectiveness in mice. These insights may guide new therapeutic strategies in lung cancer care. A large cohort study in China has linked the bacterium Clostridium inocuum to a higher risk of preterm birth. The mechanism appears to involve degradation of estradiol. More than 5,000 women were studied, with 11 microbial groups implicated. Replication in populations outside China will be critical to confirm these results. A Swedish study has shown that adherence to dietary patterns, such as the Mediterranean, DASH or AHEI diets, delays the onset of dementia and cardiovascular disease. In contrast, inflammatory diets accelerate the development of multiple chronic conditions. The study followed 2,400 adults over 15 years. Bone and muscle outcomes were less affected. A genetic study has identified that the rapid evolution of layer 2 and 3 intratelencephalic neurons in the human brain is tied to autism-associated genes. This suggests an evolutionary trade-off, where enhanced cognition may have come at the cost of higher autism risk. Finally, Welcome Leap, in partnership with the Gates-funded Pivotal Initiative, has announced a $100 million commitment to women's health research, with ambitions to scale this to $1 billion. Currently, only 1% of global research funding outside cancer targets women's health. New programs are expected to launch in 2026, addressing long-standing inequities in research investment. Stay ahead in public health research, like, share and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com.